and we would encourage them to get vaccinated for H1N1. And the earliest you can get your seasonal flu, we say you should get it. A lot of people wait until November and December and think, well, then I'll be immunized during the peak of the flu season, which tends to be January, February for the seasonal flu. We're encouraging people to get that earlier, and then when the H1N1 vaccine supply becomes available and much more available, then they could get that second.
And you really have two lists of people getting flu shots at this point in terms of vulnerable populations. So really it's, you know, people above a certain age or who have infirmities or health conditions that are susceptible to flu need to be getting those shots right now, and the supply is freely available at local clinics and doctors' offices right now for the
seasonal flu.
For the seasonal flu, right? H1N1 is a little different.
Well, H1N1 is a little different because a couple of things. One, first of all, it's all paid for. So there's an administration fee, which will be significantly less than what it would be for a seasonal flu shot. But the federal government has paid for all of the H1N1 flu vaccines. So they're coming to the state, and the state is distributing those to, in Ramsey County, 120 different locations that have requested to get H1N1 flu vaccine.
So there'll be plenty of information that's going to be out for the public for specific populations too. I mean, community clinic sites and school district as well. Are they going to be
well, I don't know that they're going to be doing any in the schools. At this stage of the game, the school is talking about doing some evening flu clinics when parents and children can come.
Right.
But at this stage of the game, we're relying upon the majority of people in their primary care facility. We expect that community clinics will be able to provide this without an administrative fee, so they could get the shot free there. And we expect that probably come late October, early November, that we'll be setting up some flu clinics in the public realm for those people that don't otherwise have a place to go.
Do you have a sense of how many people we're talking about in Ramsey County that would be getting those shots?
Well, we say within Ramsey County there's about 175,000 people that fall into the priority groups, and that is pregnant women, children 6 months to 14 years of age, or excuse me, 6 months to 24 years of age, families with the children younger than 6 months, healthcare workers, and people up to 64 who have some kind of chronic condition that might exacerbate if they get the flu.
So that's really the target population.
That's the target population
that we're talking about over the course of the year.
For the H1N1. For the seasonal flu, that target population then goes up and includes the elderly, which is where most of our deaths, and we have, you know, in the state, we see about 600 people who die every year from the seasonal flu.
And I guess that's the thing that's curious about influenza in general, is that it affects a lot of people, and then it does have a mortality rate that's sort of hidden.
Yes.
Because of the effects that it has over the course of a winter and the populations that it's working with.
And part of that is that it does affect the elderly people. And even elderly people getting vaccinated don't have 100% coverage from that vaccine. So they may still be susceptible to get vaccinated and still get a milder case of the flu. But it does impact elderly people who may have some emphysema or some other type of respiratory disorder or some other type of reduced immunity, and those are the ones most vulnerable.
And I guess for those people who are curious about why it's, why there's been a delay in getting this, getting the H1N1 virus vaccine out, people have to realize the enormity of the task of trying to create a vaccine, right? It's a monumental task that the federal government by necessity has had to get involved with, right?
Right. The issue with vaccine, it's grown in fertilized eggs, and that's a lengthy process, and most of the companies that have the capacity to do that are pretty well taxed just to do the seasonal flu.
Right, so they're distributing hundreds of millions of doses, and it's not just in the United States, it's
around
worldwide.
The world. Correct. And so they had to shift their production and increase their production to get this H1N1 out. There are 5 companies that make it, and they've now all been certified to provide this vaccine. And It's coming in at a rate of 10 to 20 million doses a week into the national scene, which means Minnesota would get about 2% of that based upon our population. So we'd be seeing between 200,000 and 400 doses each week as the vaccine becomes available.
And at one point there was a supposition that there'd have to be multiple shots for H1N1, correct?
Well, and I think it will have to be, right now we know that for adults, people 24 and older, they will only need one dose. We believe, though, that for younger people, even with the seasonal flu, younger people, children need 2 doses of the seasonal flu, so they'll still need to have 2 doses of the H1N1 vaccine also.
So why is that? Is it just because of the variation in the virus, or?
No, it has to do with the vaccine production and the fact that you don't give a full dose of that vaccine to a child because of the vulnerability, therefore you give it over a period of time. What happens is that when the vaccine gets into your body, you create immunities. For the seasonal flu, it usually takes 4 weeks to get those immunities up. With children, you want to give them a little bit now, and maybe 3 weeks later a little bit more, and then maybe in 3 weeks they have their immunity up.
If you're just joining us, you're watching the St. Paul Forum. I'm Mike Wassenaar. We're talking with Rob Fulton, who's the Director of Public Health with Ramsey County, about the flu season here this year, complicated by the emergence of the H1N1 virus worldwide. An outbreak emerged earlier in 2009, went to kind of disappeared for a while, went actually into the southern hemisphere. We can talk a little bit about that as we continue the conversation. But what we're talking about on this edition of the program is things that you could do, as well as the groups that you work with could do to be preparing for this year's flu season. If you want more information about the conditions here in St. Paul, information that you can take advantage of with your family, as well as information, I think generally as well in terms of what your business can be doing to be protecting and thinking about employees and even your customers as well, go to Ramsey County Public Health's website, which is there on the screen. It's www.co.ramsey.mn.us/PH, which doesn't have anything to do with acidity. It has to do with the public health. There'll be information updated on a regular basis on the website about conditions in St. Paul and public information that's useful to you as you're thinking about your health and the health of your community. That's the Ramsey County Public Health website. We'll have that for you here as we continue the conversation with Rob Fulton on this edition of the St. Paul Forum. So it didn't go away over the course of the summer. It went south for the summer. This is the interesting thing about influenza, is it kind of moves around the world and mutates as it moves. It's sort of a different way of thinking about viruses and diseases. It's like a rotating viral spread, right?
Well, it tends to be a cold weather disease.
Right, because of the stresses on individuals' health. And
it's more related to congregation, how people congregate.
People are inside.
More, they're in schools more, the air is drier, and it's more vulnerable in dry air than it is in humid air. So there are some of those factors. What we were looking for in the southern hemisphere was whether there was any mutation in the H1N1. And Australia has done a lot of research on this, so has South America, and we found that really it didn't change, it didn't mutate at all. It seems to be keeping pretty much to the characteristics of the virus we saw last spring. And so we're somewhat relieved that it hasn't gotten worse. As you know, in 1918, what started out as a mild H1N1 here in the US got over to the European and in the World War I in the theater of the war.
Yeah, these close,
and then
close
came
conditions
back.
with the soldiers, it mutates.
Well, and then you put all the soldiers in boats to bring them home, and they arrived home and spread a much more serious disease. You know, the first soldier who got home to the US in Albert Lee and went out to his farm in Wells, and he died, and his sister died, and his family got ill. And that was the beginning of the 1918 epidemic here in Minnesota.
And how many people died? I mean, there's not really a firm estimate, really, in terms of.
Well, there's wild guesses.
Wild ranges, right? Yeah.
From millions to 600,000 maybe in the U.S. It was pretty hard to tell because we didn't have good statistics in those